Hello my dear ones. In today's video, I will explain about Obsessive-Compulsive Disorder. I will explain OCD cycle and ERP cycle as well. ERP stands for Exposure and Response Prevention Therapy. And I will tell you 10 amazing techniques which will make your exposure more effective. Before we start, I want you to download my app, which is available in Android phone as well as iPhone. Just type my name, Dr. Kashika Jain. You will find it, download it and do breathing exercises and OCD relief meditation every day. It will fasten your healing journey. Also, do subscribe this channel, like this video, comment on this video and let me know how did you find this video. Now, let's start. This is OCD cycle. You know, OCD stands for Obsessive Compulsive Disorder. O means obsession, C means compulsion, and D means disorder. Something which is not in order. So now, what happens with the OCD sufferers? They got some triggers. Trigger can be external as well as internal. It can be any image, any urge, any thought. It can be anything which you can sense through your five senses, or you can recall, means your memory based. So trigger can be anything. So whenever someone exposed to their trigger, they have obsession. Something automatically pops up in their mind. So obsessions are in mind. It means they have a preconditioning with that trigger. So when they exposed to the trigger, automatically, without effort, suddenly something pops up in their mind. It can be anything. So they have a certain belief about that particular trigger. And because of that obsession, they feel anxious, distress, fear. And to release that anxiety, to release that discomfort, to escape from that fear, a person usually do some compulsive behavior. It can be avoidance, it can be taking reassurance, or it can be performing some rituals. And compulsions can be repetitive, means you do one time but you are not satisfied. You are again repeating it. And when you do compulsion, you feel temporary relief, but it reinforces your OCD. And this is how OCD cycle keeps going on. A person feels stuck in this OCD cycle. So let me revise. You get a trigger and with the preconditioning effect, you have some obsession, you have something, a distorted belief, a thought, urge, image, it can be anything which automatically pops up in your mind. And that obsession gives you lots of anxiety, distress feeling, and to release those feelings, a person performs some compulsions, avoid, take reassurance, and that compulsive behavior gives a person temporary relief, but it reinforces OCD. It means performing compulsions are not the solution. So you need to stop performing compulsions, but it's not easy, it's hard. Why? Because a person feels lots of anxiety. It feels that it's very hard not to perform compulsion. And they fail to understand that there are other ways to release the anxiety. They think performing compulsions are the only way to release those anxiety. And OCD sufferers do lots of mistakes as well. So I already made a video on the mistakes which OCD sufferers usually do. If you haven't watched that video yet, I request you to watch that video now Let's move to ERP cycle. So, trigger will be the same because you cannot remove triggers from the environment. So, you will definitely expose intentionally or unintentionally to the triggers, and automatically, because of that conditioning effect, you will have that obsession. And that obsession will certainly give you anxiety and distress feeling. But here, you are not supposed to perform any compulsion. You need to stop taking temporary relief. Because if you keep seeking temporary relief, you will never come out of this OCD cycle. So first set up your mind, I need to break this OCD cycle, and you need to resist and confront your trigger. This way, you stop performing your compulsions, stop seeking temporary relief, and this process stops reinforcing your OCD. It's hard, I understand, I can empathize with OCD sufferers, but this is the only way to break the OCD cycle. You need to develop self-control. Gradually, you will develop that self-control. Initially, it feels very hard because when you feel anxious, that uncontrollable anxiety, sometimes your brain interprets that anxiety in a very catastrophic way, always see the worst case scenario, and brain seeks safety only, and it actually makes you more anxious, and you feel a very strong urge to release that anxiety by performing that compulsion. But believe me, compulsions are the real problem because it reinforces your OCD. Now, to make exposure more effective, you need to keep these 10 tips in your mind. First, understand the basic of ERP, Exposure and Response Prevention Therapy. Exposure and Response Prevention Therapy is a part of cognitive behavior therapy. It is the practical aspect of CBT. Exposure means you are willingly exposing to those triggers, exposing to those anxiety producing situations which are not easy to expose, but you are now willing, you are committed to face those situations, to make them neutral for you. So before exposing to any anxiety producing situation, you need to set your mind, you need to psychoeducate yourself that because you are thinking in a distorted way or you are having distorted automatic thoughts, that's why you are feeling fearful, you are feeling anxious. Actually, the trigger is not dangerous because other person in that same situation remains calm, neutral, and face that situation easily and naturally. This is the conditioning effect only with you. And when you decide to expose your situations which produces anxiety, you show a commitment, you show your willingness to cure. And response prevention means you are exposing to that situation, you are feeling anxious, even then not performing your rituals, not escaping, not seeking reassurance, not doing that ritual. You are committed and you are ready to bear that anxiety, and naturally and easily you are letting it go down. So this is the basic of ERP. This is a practical part of the psychological treatment. If you are working with a therapist creates a safe environment, create a good bond with you, and expose you gradually to your anxiety producing situations. If you are working with a friend and family, same thing you need to apply for those exposures. Next step is create a hierarchy of fears. You need to create an exposure hierarchy. You write down your triggers, your anxiety producing situation, then you rate them on a scale of 0 to 10, how anxious you feel when you expose to any particular trigger. That way, you and your therapist or your family or friend, whosoever is helping you, you both understand that, okay, these are the situations in which you feel mild anxiety, some situations where you feel anxiety at moderate level, and some are your severe triggers. And that way, you categorize easily your issues. So this is a very important part of exposure. You need to create a very clear exposure hierarchy. Then Begin with the small, achievable steps. Start with small. Start with your mild exposure, mild anxiety producing triggers. And then gradually develop your resilience power. When you start gaining your self control, then take next triggers. So whenever you're feeling anxious while exposing to that trigger or taking small steps, even understand it's okay to feel anxious. And when you start exposing to yourself, because your body and your mind is little prepared for exposing those situations but not well prepared. So initially you might feel anxiety or might not that much anxious because you are already well prepared. But always be prepared that you can feel anxiety even if you are taking very small steps. But when you start taking steps towards your healing journey, then you develop self-control and you start breaking the OCD patterns. Then stay in the exposure until anxiety decreases. When you expose to your trigger, so it's very natural to feel anxious and you're not supposed to come out of that situation without facing it completely. Stay in the exposure. Cooperate yourself, cooperate your therapist or family friend, whosoever is working with you. Stay in that situation. Even if you're feeling too much anxiety, understand anxiety is not life-threatening. You are safe. And when you keep telling your brain that I'm safe and I'm ready to face this situation, so it feels easy to stay in the exposure even if you are feeling anxiety. So you are safe with this belief. Stay in that moment and let your anxiety naturally go down by the time. Resist compulsion. That's good, you faced with a partner that situation, but you need to practice it. You need to resist compulsions. No matter how anxious you feel, when you practice it alone, you're not supposed to do compulsions, because what you learned during the exposure, if you do not repeat it and you think, oh, nobody is watching me now, let me give myself a quick relief, let me do my compulsions. So then you're cheating on you. So you need to resist compulsions every time you expose to your triggers. Next is expect and accept anxiety. When you are exposing to your triggers, expect that you will definitely have anxiety. When you expect and accept it's okay to feel anxious in that situation, then it feels very easy to handle that anxiety state. Remember, every state keeps changing, even the anxiety one. So it will change. Just have patience, have this belief you are safe. Anxiety is not life-threatening. And unless you face your triggers repetitively, you will not feel normal naturally in that situation. So it's very, very, very important to face your triggers repeatedly. Next step is be mindful of mental rituals. Of course, you are not doing any ritual physically, but sometimes it shifts to the mental rituals. Make sure you are mindful, you are connected to the present moment and not engaging in any mental ritual. For this, you can try grounding technique 5, 4, 3, 2, 1. Wherever you are, simply notice 5 things. Look around and notice 5 things. You can touch 4 things, hear 3 things, 3 voices, and 2 things you can smell and 1 thing you can taste. Or simply watch your breath. It will help you to connect to the moment and you will not engage in any mental ritual. Next is practice regularly. Practice, practice, practice. The more you practice, more easy it becomes for you to face that particular situation. So practice is the key. Practice in different scenarios, in different situations, through different ways. But practice, practice, practice. Practice is the key. Next, use self-talk and acceptance. Your self-talk must be very positive, accepting. When you keep telling your brain, oh, this is very hard for me. What if I exposed to that situation and I feel more anxious? And what if something happens with me? If you talk to yourself in that way, what do you think? Will you be comfortable in that situation, or simply you will feel more anxious because you already leading your brain towards more anxiety? You need to be mindful about your self-talk. Always talk to yourself this way: hey, I'm trying my best, and every time I expose to that situation, I feel more easy. I understand. Anxiety is not life-threatening. I'm safe and I want my freedom back. I am more stronger than this OCD. It is just a conditioning effect and I am ready to break it. I am strong, I am confident, and I am ready to face it. If you talk to yourself this way and if you accept that brain will send you the signal, brain will send you that urge to perform some compulsions, but you are master of your life. You are not supposed to address that urge because you have control over your actions. If you think, if you believe, if you commit yourself that no matter how anxious I feel, but I will not perform any compulsion, that commitment will help you to stay in that exposure, and easily and naturally you will feel that anxiety diminishes automatically and the habituation process happens easily and naturally. What happens when you expose to that situation? So anxiety starts building and it goes to the peak, and if you stay in that exposure, it automatically diminishes. And habituation process means a natural process where anxiety diminishes happens. So support yourself in this healing journey. And next, the last and most important tip is track progress and adjust accordingly. You need to document your progress. After every exposure, write down your progress. How did you feel during the exposure? How are you feeling after the exposure? And rate yourself. Before exposing, your anxiety level was, I think, 7, 8. After exposure, that anxiety level going down or up. So you need to track your performance so that you can keep an eye on your performance. So when you keep having the positive experiences, it increases your confidence. You feel more motivated, more confident to face that trigger, and easily and gradually it boosts your confidence at that level that very soon by repeated exposure you feel very easy and calm, and that trigger becomes very neutral for you. Like it is neutral for others, it becomes neutral for you too. So these were the 10 most effective techniques which makes your exposure more effective. I hope you liked this video. Please do share it with your friends and family, with other OCD sufferers, and remember to like this video and leave a beautiful comment for me. I will see you in the next video. Take care.